Hi, my name is Valerie Shirley, and this is my expressive language therapy session plan for SLP 212. And basically, what I'm going to be doing is utilizing a 5-minute story time storybook to target the expressive language goal of getting my clients to be able to retell this story, the beginning, middle, and ending of the story, and also the goal of improving their expressive language by being able to formulate their own questions appropriate to the situation, which, being retelling the story in the book. So some of the materials that I'm going to be using, of course, the storybook, and I'm going to be actually starting out the session by asking them some non-story related questions like Caitlin, when is your birthday? Brian, who is your teacher? And I will have all the WH questions on these little handheld signs, and they're visually appealing, aid in retention, and we're going to utilize these later in the session. And I will do that before the story. I will then read the story. It'll take about 5 minutes, and I will probably double that time because while I'm reading it, I will ask them questions and get them hopefully conversing and talking. And I will use those opportunities to make any corrections, like perhaps in their verb tense, or for instance, if they say Alice folded down the hole, I will correct them and say, you're right, Alice did fall down the hole. And did she hit the bottom? And I will expand on those. Every opportunity of any verbal output that they're giving, I'm going to use those opportunities to expand on it or introduce a new vocabulary word, so on and so forth. Uh, the goal is get them talking more. And also added benefit is they will be interacting with each other. And I guess I should mention that my session plan is going to be K through 3 children in a school setting, and I imagine it'll be about, maybe 4 or 5 at the most in the group. And because we have varying age groups, I will have to target some of the little tasks within the activity. Like maybe I have some Play-Doh modeling clay. Those will be for the younger, maybe the kindergarten age children, because they might not be able to actually write down some of the words. That's for maybe the first, second, and third graders who are able to write. And basically after the story, what I'll do is the goal is ultimately for them to be able to retell the story, and we will break off from the story and I will ask them questions. The ones who are using the Play-Doh, I will encourage them to mold some of the characters, maybe actually form some of the letters like A for Alice, or maybe they can even, what I have here is W, H, and O for the who question. If they're having trouble with it, I of course will support them, get my hands in there, even maybe on top of theirs, and help them form it. For some of the other students, what I will have them do is I will have scented markers and have them write out various elements from the story, like maybe they can draw a cat, write out Alice, maybe write out one of the who questions, who, the rabbit, anything. If they want to write down a question they have, it's on there. They can use as many pages as they want. And for both of those activities, I'm actually utilizing like multi-modality, multi-sensory experiences there, and that'll help with retention later. The scented markers, the colored paper instead of a plain white paper, the different colors of clay, actually tactile, kinesthetic learning styles implemented there, getting their hands in there and actually doing it. All of that aids in retention. Even these things, they're kind of funny looking, visually appealing, but you will remember these. When I ask these questions, what was Alice doing before she fell down? I will have the kid who's holding this hold it up and maybe wave it for everyone, and so on and so forth. There'll be all of the WH question words. I'll have one for each of them. And the ultimate goal at the end is to When we come back from all of these activities, we'll gather the group and get them to hopefully retell the story. And if any of them need any assistance along the way, I can prompt them with questions, go back and show them some of their visual aids to help them remember, go back over some of the papers they drew, and if the tasks are seeming too easy, I can make it more difficult by asking them harder questions, so on and so forth. Same thing with it. If it seems too difficult, I can actually pull back on it and ask them easier questions or actually implement fewer new vocabulary words. In the end, the goal is to get them talking, give me opportunities to react to the verbal output, like correcting verb tenses again, or showing them how to use the correct word order in a sentence, modeling a new vocabulary word, modeling writing down a word, and I will get them to use these later on when we're retelling elements of the story. Who did what happened, where, when, why, so on and so forth. At the end of the session, I will be allowing them to take this home, and that will help with the carryover and retention aspect. And I will be giving out these little mini tubs of the Play-Doh, which they can use at home to maybe recreate some of the characters, some of the letters, and whatnot. And basically, that's the essence of my expressive therapy session plan. And I think that covers about everything. Thank you very much.